So my name is Dr. Paul Sasaura. I practice in Sacramento, California. I'm in private practice. I primarily do joints. That's about it. Primaries and revisions. So my interest in adopting Navio was an evolution. So I was an early adopter of CAS, or computer-assisted surgery, way back when it first came out. I thought technology was definitely a way to make me a better surgeon and improve my outcomes. Robotics or robotic assisted surgery came about years after computer assisted surgery came about. And of course, once robotic assisted surgery came out, it was an immediate interest. How can I argue with trying to become more accurate than I currently am? Navio is the current newest generation of robotic assisted surgery. And for me, that was of great interest. So Navio has changed my practice in that it gives me the ability to offer something that one, not all other surgeons are doing, but truly, I think, better outcomes for my patients. The bottom line is, for any surgeon doing joint replacement surgery, it's all about planning that operation and then executing that operation. And Navio robotic assisted surgery is an incredible tool to accomplish just that. I think Navio provides just incredible a tool for the surgeon to accomplish what he's trying to accomplish. Again, I think the bottom line for any joint surgeon is what we're trying to do is be able to put in a total joint for a patient that we know is in proper alignment, that's going to function well for that patient and improve their outcome. We can do that thing, we can accomplish that very goal with standard manual instrumentation, but if we want to become more accurate, if we want to be able to really achieve the goals we set out for us at the beginning of a case, then robotic assisted surgery, specifically Navio, is the best way, in my opinion, to do that. So in terms of outcomes, I think the biggest thing for the orthopedic joint surgeon is one, at the end of the case. So at the end of every case, the surgeon knows how he wants that knee to feel in his hands when he puts it through a full range of motion. And using Navio robotic assisted surgery, at the end of the case, you're always happy. That knee always feels exactly like you want it to when you put it through a full range of motion. In terms of outcomes for the patient, that translates to a knee that moves well for the patient, a knee that feels good to the patient, and a knee that is going to function well for them as well. Get that patient back on the road to recovery quicker and get them back to the activities they love to do quicker. So in terms of my adoption of the Navio technology, I was an early adopter of computer-assisted surgery, and when robotics came out, for me it was a no-brainer. Not only do we have the advantages of computer-assisted surgery, but with robotic-assisted surgery, we now can improve the accuracy even above and beyond what we could with computer-assisted surgery. I was an early adopter of a competitor robotic-assisted system when it first came out. And when Navio came out as the newest generation of robotic assisted surgery, it was very interesting to me in the portability, ease of use, particularly in an outpatient surgery center. The footprint of the Navio system is incredibly small. It's very mobile, and still it accomplishes everything I wanted to accomplish in getting the outcomes I needed. The Navio robotic assisted system has a free held handpiece, which really allows a surgeon to have infinite degrees of freedom in terms of approaching the knee. To me, that's a huge advantage in terms of just the technicality of trying to accomplish the cuts and getting the implants in. So I'm a very huge fan of the handpiece that Navio offers. I think a common fear of surgeons that are new to one, computer-assisted surgery, and two, robotics or robotic-assisted surgery, I think the fears are well-founded in that anytime you're trying something new, it's going to be more difficult. There's no question. There's always a learning curve to whatever technique or technology that we adopt. I think the most important thing is, what is your long-term goal? What are you trying to accomplish? And for a joint surgeon, that's very simple. We're trying to come up with a perfect plan for this particular patient, and then we want to execute that plan to the best of our ability. And robotic assisted surgery is the only way to really make that happen. Anything short of that is subject to human error. And there's no question that robotic-assisted surgery is more accurate than what I or any other surgeon for that matter can accomplish on their own. Currently, I use or utilize robotic-assisted technology in both the inpatient and outpatient setting. I think in the future, there's going to be a shift more from the inpatient setting to the outpatient setting, again, more and more as we go forward. I think it becomes even more important for us surgeons to do even a better job, particularly in the outpatient setting. These patients are going to be up and about quickly. They're going to be going home primarily the same day as their operation. For us to be able to put in a knee confidently that we know is well aligned and functioning well is really important. So convincing the hospital system to purchase a robotic assisted system was fairly easy, in that I think everyone in general knows and understands that robotics has become and is continuing to be a more and more important part of everyday life. I see healthcare, particularly orthopedic surgery, which is incredibly technologically oriented, that it's going to become more and more important and a bigger part of it. There's no field in this world that's been touched by robotics that has gone forward with less robotics. I think as technology continues to improve, I think the demand is going to improve. And so for a hospital system to really understand that, it becomes an easy sell, saying, look, if you want to be part of the future, robotics is it. For the outpatient setting, it's the same story. Again, as more and more cases are going to be done in an outpatient setting, I think outpatient centers are going to be wise to adopt technology to be able to capture that part of the market. So I explain robotic-assisted surgery as a very fancy tool to help me do my job. So my job is to get the implants in at the best alignment possible with the best fit possible. Again, robotic-assisted surgery is the best tool available to accomplish just that. I liken what we do as joint surgeons to patients putting up a picture on their wall. So if you've done that plenty of times in your lifetime, you can hang a picture on your wall. You can look at it, you can see its center, you can see its level. And because you've done it so many times, you're going to be pretty close. Surgeons no different. We've done so many total knees, we've become very good at accomplishing what we want to accomplish. But if you want to hang a picture accurately on your wall, you're going to take a tape measure, you're going to take a leveler, and you're going to make sure. And that's exactly what robotics does, or robotic-assisted surgery does. It's a very fancy tool to help us accomplish our goals. A few phrases to sum up Navio. I would say high-tech. I would say incredibly accurate. I would say robotic-assisted surgery is the wave of the future. I think the wave of the future is here and now, and I think it's going to become a bigger and bigger part of what we do as orthopedic joint surgeons.